You've been dispatched to the home of a 7-year-old male for an unconscious collapse.
Okay, before we enter the scene, we're making sure that we have donned the correct PPE gear on. So we have our gloves and our glasses and the correct footwear. Because it's a residential area, the main thing that we're worrying about is that we might have, the hazards would be pets and obviously bystanders. We're thinking about the time of day that we are entering, and we're also thinking about scene access and egress as well. In case this is a cardiac arrest, we're making sure that we have our defib. We also have our suction and our oxygen. So, Jenny, you happy to approach?
Happy to approach.
Okay, great. Hello, sir, can you hear me? Sir, if you can hear me, open your eyes. Okay, he's not responding to, doesn't seem to be alert, he's not responding to voice. Okay, quick trap squeeze here. Sir, if you can hear me, open your eyes. He's not responding to pain as well. So I'm just going to use the head tilt chin lift to check his airway. There's no obstructions right now. Jenny, I need you to turn on the monitor, please.
Yep.
Put it to manual mode.
Yep.
Okay, there's no obstructions. I'm just going to look, listen, and feel for 10 seconds. And while I'm doing that, attach the defib pads, please.
No worries.
Jenny. Okay. I can't hear any breathing sounds. He's not breathing, so I'm going to start compression straight away.
Yep.
Jenny, I want you to charge
Pressing charge.
and also call for backup.
81 to comms. We'll be seeing R50, confirming R49.
Okay. Get ready to shock, Jenny, but just hold on. Recognizing that that's VT, that's a shockable rhythm, shock.
Shock.
Okay. So that shock was delivered at 44 seconds. We are going to reassess at 2:44. Jenny, I need you to attach a size 4 LMA.
Yep.
Also to 30 meters of air. Please turn that off. Okay. And attach the COPS connector and also the entitled CO2, don't forget that.
Yep.
Okay, I'm trying to give 100 compressions a minute. And while I'm doing that, I'm just waiting for Jenny to fix in the LMA. Right now, we don't have any bystanders around, so we can't grab any patient history. As we walked in, we did not see any empty vial bottles around, any medications that we could see. That could give us an idea of exactly what happened to this
Just
patient.
to check the LMA.
Okay.
3, 2, 1.
Okay. Good chest rise there. You can secure that now, Jenny.
Yep.
Okay. Happy with gear placement. The monitor is right in front of me and Jenny. We have a good visual of it. Suction is there if need be. Also oxygen. Jenny, set that to 15 liters, please. High flow oxygen.
Yep, 40 is.
And we have the bag in between us in case we need that. So there's no anybody else around that can give us any patient history. It's quite warm in this room. We're trying to see if there's any evidence of exactly what happened, whether the patient did ingest something.
Just securing.
Securing that.
Yep.
Okay. Let me know.
Ready when you are.
5, 4, 2, 1.
Yep.
Okay.
Just right.
Okay. We're going to charge in 10 seconds.
Yep.
So can you... Okay, charge now, please.
Charging.
Okay, great.
25, 26,
And you get ready to
27,
shock.
28,
And then you're going to go over the
30.
head. Okay, recognizing that's VF. Press shock, stand clear. Okay,
Shocked.
go over the head, please. And start. I'm going to do ventilations. As well. Okay, shock delivered at 2:42, and we are going to reassess at 4:42. Thank you, Jenny. If you're comfortable with continuing that, I'm just going to do a trauma sweep.
No worries.
Okay, so Jenny's going to do 30 to 2, 30 compressions to 2 ventilations. So I'm just checking, just going to work around you. Checking that I do not feel any fractures. Just checking there. Checking for blood. There's no blood pooling anywhere. Cannot see blood. Do not feel any broken bones. Checking underneath. See if there's any pooling under the patient. Nothing there. Palpating now. Do not feel any hard masses. Seems to be tender upon palpation. Okay. Checking the femur. There is no angulated joints. There's no blood, no cryptus that I can feel. Checking the right side of the femur, same thing, cannot feel anything. So I'm confident that this is not, patient has not sustained any trauma. Okay, Jenny, I'm just gonna go press charge, and then when I tell you to shock, please shock.
Yep.
Okay, charging. And then we're gonna swap. I'm
Yep.
gonna take over. And we're gonna do ventilations.
Yep.
Okay, please press shock. Recognizing it's asystole, dump that, please.
Dumped.
Okay, shock was dumped at 4:52, and we will reassess again at 6:52. So count me down, 30 to 2, please.
Yep.
Have my impressions.
19, 20, 21, 22, 23,
Okay.
24,
I'm
25.
gonna start with hypoxia.
7, 8, 9, 30.
I'm confident that we are reversing hypoxia because we're putting the patient on high flow oxygen. So they're getting adequate oxygen. Also thinking about hyperkalemia. If it was
30.
hyperkalemia, we would, if the patient was to get ROSC, we would do a 12 lead ECG and just attach a 12 lead and check the patient. If there was hydrogen ion acidosis, we can't check that because we don't have a patient history at the moment.
30.
Toxins, we can't see any empty vials around, so we don't know whether the patient has ingested any toxins. We also cannot smell any alcohol as we were doing ventilations on the patients.
26, 27,
And
29, 30.
hypothermia, the patient was warm to touch, so we can rule that out. Thrombus, we can't check that. They would only check that in a hospital setting to check for either PE, MI, or a CVA.
23, 24, 25, 26, 27, 28, 29, 30.
Tamponade, we also can't check that.
Yep.
We can't check that, but we can't also see any JVD on the patient that would suggest tamponade. Jenny, I need you to auscultate on the next ventilation to check for tension pneumothorax.
Yep. No worries. 1, 2, 3.
Okay. Great, thank you. Trauma, we can also rule that out.
Sounded equal and had equal chest rise bilaterally.
Okay, I'm gonna reassess soon. Okay, we've done hypoxia, hyperkalemia, hydrogen ions, hypervolemia. There's no blood pools, we can rule that one out.